All right, good afternoon. I want to welcome you all to the Atlanta Journal-Constitution Community Conversation, where we will focus on the upcoming school year and how it will look as we continue dealing with the ongoing coronavirus pandemic. I'm Marlon Walker. I covered DeKalb County schools for the last 5.5 years for the Atlanta Journal-Constitution. Over the next 90 minutes, we will be discussing reopening strategies with leaders from across the nation, the region's largest school districts, as well as pivoting many are undergoing as the coronavirus infection rates in Georgia spike. Monday, several Metro Atlanta school districts, including Atlanta Public Schools, DeKalb County Schools, and Clayton County Schools, delayed the start of the school year. August 10th for Clayton, August 17th for DeKalb, and August 24th for Atlanta Public Schools. They also announced the school year would begin with classes held virtually due to the coronavirus statistics locally. Cobb County Schools has delayed the start of the school year to August 17th. It is also giving parents an opportunity to decide whether students will attend virtually or in person. Gwinnett County, the school year has been delayed until August 12th, and that same choice is being given to them about brick and mortar buildings versus virtual learning. Fulton County Schools will return to schools August 17th, delayed from its original start date. Students there will also be given the option for either in-person or virtual learning. That all could change as the coronavirus infections continue upward. This is the first of several community conversations that the AJC will be having in the coming months around the COVID-19 pandemic and its impacts on what exactly we do and where we're allowed to go. I've been covering K-12 education in Atlanta for the last 5.5 years again, and I believe this may be the first time the superintendents from the area's largest school districts have been assembled in one place. We're doing it virtually, so we don't have to really deal with Atlanta traffic today. So today, this afternoon, we have with us Dr. Morcease J. Beasley, Superintendent of Clayton County Public Schools. Dr. Beasley, how are you this afternoon?
Doing well, Marlon. Thank you. Glad to be here with the entire metro area.
We also have Chris Ragsdale, the superintendent from Cobb County School District. Mr. Ragsdale, how are you?
Doing great, Marlon. Appreciate the opportunity for all of us to get together today.
Okay. I think I hear a phone. I don't know if everybody's put everything on mute before we got started. Then we've got Mrs. Cheryl Watson Harris, who recently was named superintendent for the DeKalb County School District. Ms. Watson Harris, welcome to Atlanta. How's it been so far?
Oh, thank you, Mr. Walker. It's been wonderful. Today's my 11th day, and I couldn't think of a better way to spend it with all of you than with all of you. So thank you very much.
I'm grateful to have you this afternoon. We've also got J. Alvin WILBANKS, Gwinnett County School District Superintendent, and one of the longest serving superintendents in the country. Mr. WILBANKS, how are you this afternoon?
Marlon, I'm doing great.
Good to hear. We also have Grant Rivera, Superintendent for Marietta City Schools. Dr. Rivera, how's it going today?
Doing well. It's good to be with you, Marlon, and certainly great to be with my friends and colleagues.
Absolutely. Richard Woods, Georgia's school superintendent, may join us later in the broadcast. He's among a delegation greeting President Donald Trump during his visit here today. I guess that means he's got a good reason for being tardy. We want to thank you all for being here, taking time out of what certainly is a very busy time as the plans for reopening schools appear more like a moving target these days than anything else. I have to give a shout out to my colleagues who've helped keep parents, students, and teachers informed as schools quickly shift to best serve students while helping curb the spread of the coronavirus. They include Arlinda Smith-Brody, the brainchild behind this forum. She covers Gwinnett County Schools. You've got Vanessa McCrae, who covers APS. Leon Stafford, who covers government and schools out of Clayton, Henry, and Fayette counties. Crystal Dixon, who covers Cobb County Schools and government. And Ben Brash, who covers everything in Fulton County. I want to thank my employers at the AJC for hosting this conversation. It is the only place where you will have area school leaders assembled to answer questions that you may have ahead of the school year, that we know of anyway. We want to thank our readers and subscribers. Without your loyalty, engagement, tips, critiques, and positive messages when we go above and beyond, none of this would be possible. Nearly 3,000 of you have signed up for today's conversation. We thank you for that, as well as the hundreds of questions you've submitted for our school leaders and hundreds more who are joining us on Facebook and YouTube. Let's get started. I've got a series of questions generated by our audience and a few from my colleagues. Some are specific to school districts. For those that are not, I'll randomly call on several area superintendents for their thoughts, with hopes of asking as many questions as we can. My editor, Todd Duncan, will be keeping watch on social media for other pressing questions as they come in. Don't hear yours heard? Send it on social. Like I said, we're on YouTube, on our AJC YouTube channel, and on our Facebook channel as well. So question number one is going to go to Cheryl Watson Harris, as I feel I have to pick on her since I cover her district. Ms. Watson Harris, you were part of the planning team for reopening schools in the New York City Department of Education, where you were second in command before coming to lead DeKalb. Is there anything you learned during that process that will be implemented in DeKalb's reopening plan?
Oh, thank you so much for that important question. And yes, I had the pleasure and honor of serving as second in command of the New York City public school system, which was really the epicenter of this pandemic. And unfortunately, was a part of the team that supported our system as we lost a total of 79 combination of staff and students. Wow. So that's a real tragedy. So my experiences there definitely have informed the decision-making process here. First, beginning with ensuring that the safety of our students and staff remained our number one priority, whether that be the physical safety of the students or the social and emotional mental health of our students. And we use that information from our community input, our survey, feedback from teachers, parents, and scholars, as well as the public health data to make our decision to delay the start of school, as well as to begin remotely. Also, something that we learned in New York is that, and we're learning this all around the country, is that this is a new world for us. And there's a lot of uncertainty. So to maintain the values of being patient and flexible. And that's why in our plan, you'll see that we've built in predetermined assessment windows where we will look at the current data and make any changes as necessary. And then lastly, in terms of our approach from New York City, to make sure that it's as comprehensive as possible. And so our team is working on not only answering the question about when we're starting school or whether we're starting remotely or in brick and mortar, but also that we're looking at the needed professional development from lessons learned in the spring, communication with our families to best equip our parents to serve in this new role as both parent and assistant to the teachers, as well as our plans to really address the digital divide that exists and ensuring that all students have the devices that they need and the bandwidth and access to Wi-Fi. So I feel as though I'm coming out of the worst of this in New York City with the trends going down and entering in a place that I hope that I can be a resource not only to the DeKalb County School District, but all of my colleagues on the line as I also learn from them. So thank you so much for the question.
No, thank you. And I have to go back and fix myself. I forgot to introduce Dr. Mike Looney from Fulton County Schools. Dr. Looney, sorry about that, and good to have you here this afternoon.
No apology necessary at all. I'll certainly have my opportunity to speak tonight, so glad to be here.
Look, ironically, the next question is going to come to you anyway. So first, if you're just joining us, we're having an AJC Community Conversation with Metro Atlanta school superintendents discussing the return to school as the coronavirus rages on. I'm Marlon Walker. I'm an AJC education reporter. I've been here covering DeKalb schools for the last 5.5 years. Like I said, Dr. Looney, this next question is for you. It comes to us from our partner, WSB TV, from Mike Pachinik. The question says, Dr. Looney, you said in the board meeting this week that it was too early for you to decide to go to a virtual model, but also too early to mandate masks. What do you have to see in the data to make a decision either way? Why not make a decision sooner or later so families can make their preparations?
I appreciate the question. So Fulton County is a very geographically diverse district. And if you look at the data, we have some hot spots within Fulton County. We have some areas in Fulton County where the spread of COVID-19 is moderate. And then we have some spots in the county where there really isn't a lot of spread relative to the heat maps that are provided by the Department of Public Health. And so because of that, we want to make sure that the decisions we make are the best decisions for our entire school community.
Sounds like we're having a bit of an issue with Dr. Looney. I will come back to him. I think I see Dr. Lisa Herring.
Are you not able to hear me?
Has joined us. Dr. Herring, how are you this afternoon?
I am well. How are you?
Uh-oh. Sorry about that, folks. Dr. Herring, I think I see you down on the screen here. How are you this afternoon?
I'm doing well. How are you? Can you hear me?
I can.
Good.
Dr. Lisa Herring is the Atlanta Public Schools new superintendent. You just started yourself. What's it like being back in the A?
It's a delight to be back home. Obviously, I'm honored and grateful to be able to come back to the state and the place that I not only call home, but maintains a powerful space in my heart. And to be able to come in at a time where I can serve is one that I am eternally grateful for.
Right, and I know there are a bunch of familiar faces. So again, welcome back.
Thank you.
We are going to jump right to our next question. Dr. Looney, thank you for that. The next question comes from one of my colleagues, and I'm going to ask everybody individually, what will you do for students who don't have a parent at home who is holding them accountable for staying logged on for the required hours, getting their work done? Is there anything school officials will do if students don't have that parent at home to push them? This question comes from Taisha Fernandez from WSB. Mrs. Watson-Harris from DeKalb, I'm going to start with you on that one.
Okay, great. Thank you so much. And that is a reality that we will have some students who are perhaps falling in that situation that you described. We are making every effort to ensure that we have regular check-ins with students so that staff are staying engaged to know who is actually engaging our students and what supports they need. We're also building out a robust communication engagement plan to see how we can call on our partners, our community-based organizations and other leaders throughout DeKalb to support us with possible sites for students as well as other ways that we can engage them. So these are plans that we're working on now. However, the engagement of students and making sure that we know where every student is and that we have a plan to re-engage them is a priority for us and something that we're building into our strategic plan right now. Thank you.
Thank you. Dr. Lisa Herring, I'm going to come back to you on this one. So what does happen when you have a student at home who doesn't have a parent who might be unable to keep them accountable, maybe at work or something like that? What plans are in place in Atlanta?
So again, I'm going to thank you for the question, and let me just jump right into it. Part of our plan includes an opportunity for engagement before we open virtually. The week of August 17th through the 21st is what we're calling Runway to Learning, but really it's a focus on engagement to assess the needs that our students have experienced based on the disruption that occurred back in March. During that time, we are working to identify what type of needs exist in the household relative to the device usage, Wi-Fi usage, relative to the disruption in academic learning, so assessment for proficiency, And most importantly, and I did say most importantly by design, an opportunity to assess wellness through the social and emotional lens. In Atlanta Public Schools, we are fortunate to have mental health supports at all of our schools. And so we have also established what we call trauma to transition, which will allow for us to have the team to do a level of triaging to not only assess the needs, but then identify partners as well as our support service staff who can help address whatever challenge might exist in the household. The greater challenge in that, however, is grounded in the space of the pandemic and social distancing. We want to be able to take advantage of things such as telemedicine or teletherapy. We want to be able to take advantage of a recruitment effort that we're calling virtual volunteers. And even in virtual volunteering, there's an opportunity to connect, and particularly in those households where there would be a challenge, connect a virtual volunteer to check in. But the other part to that is also tied to how we manage instruction and the platforms that we use. We want to make sure that there's a database that allows for us to monitor usage. And we have a sense even now as to what that looked like in this past semester, where that level of participation, the day-to-day usage was low. So we're taking this time now to not only identify that population, but have strategic outreach. Because to the point of your question, that's really a part of the inequities that we see. And in Atlanta Public Schools, I'm honored that I've come into a system where equity is in the forefront of our work. It's not only a part of our strategic plan, but we've also got a policy that keeps us accountable. And part of what I hope to do in the protocol of reaching out to those households that have this type of challenge is to ensure that we have resources to connect to them and to also keep people safe while doing it.
Thank you for that. Dr. Looney, I'm going to come back to you. And like I said, I want to apologize first. I guess I'm having some connectivity issues here in the newsroom. But if you wanted, it sounds like I might have cut you off on your last answer. But I'm going to throw this one to you too after, if you needed some more time to respond to that last question.
Well, thank you. So certainly, as I was saying, our district is very diverse geographically, and as you know, we have some pockets in the community that are particularly hot spots right now. We have pockets in our larger community where we're in a moderate COVID spread situation, and we have some parts of our community that have very light spread. And so we want to make sure that whatever plan we put in place and maintain, it is in consideration of those varying levels of COVID spread. When we developed our plan and we published our plan originally, we as a state and even as a region were in a downward decline of COVID. And so we want to make sure that if we pivot again, that we pivot at the right time where people can count on the fact that we're pivoting appropriately and we're not underreacting and or overreacting to the situation at hand. And the same is true of face masks. We are prepared to make the decision to require face masks if the data as we approach our first day of school tells us that that's the most appropriate thing for us to do.
All right. Sorry about that. So to go back to that other question too. So with the student component and not possibly having a parent who's willing or able to keep them accountable while they're at home doing virtual learning, what strategies are you all using in formulating your plan for reopening schools virtually?
Well, first of all, we're giving parents a choice in Fulton at this point in time. They can make the choice to either send their child to school face-to-face and or choose virtual. There are families who, as you state, do not have a caring, helpful adult at home during the day that can provide direct supervision to a child or support. And in those instances, many of our families will choose to send their children to school. However, we have ramped up our ability to provide direct support, social, emotionally, through counseling services, and even through access to the internet with us providing devices and the district providing hotspots to families who do not have connectivity. So it's a wraparound service approach that we're providing to our families. But at the end of the day, at this point in time, we continue to maintain giving our families choice is an important element in our solution.
Sorry about that. Okay, so I am going to go to Dr. Beasley on that same question. What plans or strategies are you all using down in Clayton County, Dr. Beasley, when there's an issue where maybe a parent is unable to hold a student accountable at home during virtual learning?
Thank you, Marlon. Again, thanks for the opportunity. We'll continue to use our protocols as we do when we're face-to-face. Teachers will, of course, take attendance. They'll reach out to administrators and parents when students are not being engaged. We'll determine what supports need to be provided. If we have to, we'll even do home visits. So we're prepared. We have teams that we will be using within our county to ensure that students are connecting to the virtual learning experience. Parents are getting the support that they need. We recognize that many families will be in various situations. That's why in our virtual learning parent guide that we'll be sharing with all, parents will have the information to schedule instruction, the time that students will need, and other resources identified. So we're just going to approach it and work with our families to make the situation the best for every student in our school system.
Okay. Mr. Ragsdale, same question. What are you all implementing in terms of strategies as Cobb County
So we're just going to approach it and work with our
some students virtually?
Yeah, so much like Fulton and Dr. Looney mentioned, we're giving our parents and students a choice. So currently, we have our portal for registration open. We're also using that portal to bring the data as far as those students that might need a device. So not only are they able to register for either face-to-face or virtual models of instruction, but they're able to indicate that they need a device. So we'll be able to obtain that data in a timely manner so that we can provide those devices for those students in need. Our plans currently have a check-in time for students as well as small groups. So as I've indicated, our teachers will not be doing two jobs. Teachers will either be teaching face-to-face instruction or they will be teaching for the virtual option. So those students in the face-to-face instruction, obviously they will be getting that face time with their teachers and counselors and every employee that's within the school for their time there. But for the virtual option, we have those check-in times scheduled. We have, fortunately and unfortunately, as the case is, for the last 6 weeks of the last academic year, it was basically a trial run where obviously nobody wants to implement virtual learning over a weekend, but that's what all of us in the process of having to do. We saw things that worked very well, and we saw things that we needed to improve upon. So that being said, I have 100% faith and confidence in our great teachers to be able to get the job done, whether it's face-to-face, and still, you know, that's not a guarantee. We're not in the position yet to make a call as far as going virtual for school, but that's certainly still an option as we watch the data as far as the numbers of cases go. You know, following the guidance from the DOE and DPH, there are different levels of guidance for high spread, moderate spread, and low spread. So certainly our finger on the pulse of the spread. We were talking multiple times with our health officials locally. And so, you know, like I said, we much prefer to make the decision sooner rather than later. But at this point in time, we are still planning to offer both face-to-face and virtual as an option for our parents.
Thank you, sir. Dr. Rivera, how about Marietta? What's the strategy?
Well, and to go back to your original question, you know, how do we monitor and support students who may be disconnected from learning? And I'll share with you, last spring, many of us talked about how last spring was an opportunity to figure out what worked and what didn't work and to improve upon how we can better serve our families. In Marietta, we had 97% of the kids log into our digital learning platform between March and May. And what we know is that they need constant support from not only families, but also our counselors and social workers. Much like I think my other colleague referenced, we've done home visits. So as we go forward, our priority is going to be to support all of our children in whatever needs they may have, whether that's food, technology, engagement with the teacher, connection, what have you. That'll be our hope going forward, to make sure we're supporting all 9,000 kids in Marietta.
Absolutely. Mr. WILBANKS, how about in Gwinnett County?
We're planning to start school on August 12th. Our plans are to either we'll offer in-school instruction or digital instruction, and that'll depend a lot on circumstances. But like most anything else we talk about on this program today, it's subject to the coronavirus issue at the time we plan to open. One of the things that we know that we need to do with our students, if we do digital learning, we have a number of students that do not have reliable internet. We're working very diligently to make sure that we are providing for their to have the equipment as well as the service. We have community groups that are working with us on that, and we expect to have that intact, and they will have reliable internet service this next year if we do digital learning. And obviously, if we don't do digital learning, it's certainly good that they have internet service, and we will continue to do that regardless of whether we are able to do in-school instructions or digital instructions. In terms of staying connected with students, which is very important, I think students need to see their teachers. Teachers need to see students. We will make sure that we take attendance. We'll make sure that we have conferences set up with teachers as well as with counselors or any other any other school person that they may need, to make sure that their learning experience is the very best that it can be given the circumstances that we are working with at this time.
All right. Thank you. So we're going to go from that to one of our community questions. Margaret F. asks, how can you ensure students, teachers, and staff safely if everyone is required to return to school district buildings? I'm going to start this one with Dr. Herring out of Atlanta Public Schools.
There we go. Can you hear me, Marlon?
I can.
Yes, so for clarity, in Atlanta Public Schools, we are starting virtually. For the exact reason that I'll give you this response, because we want to be able to give a high level of reassurance in this regard, recognizing that there are social distance practices that have been put in place, and that there have been guidelines, not only from the Georgia Department of Education, but also from CDC, from researchers for whom this is their wheelhouse. But even in those guidelines, the ability to give a 100% guarantee right now feels like an impossibility. So to that end, when we are physically in place, even in tiered models, in isolation with small numbers of individuals, we do practice things such as temperature checks. We do require masks at all times in Atlanta Public Schools in compliance with the current community spread. But because of the inability to give a full level of reassurance in terms of safety and protection for us, the action has been grounded in a virtual launch. When we're able to note by virtue of the data, the decrease in the trend relative to spread from moderate to low, it'll give us a higher level of reassurance. But we also know that even then, it does not give us a space to give a 100% guarantee. And I think that's grounded not just in the reality of being educators, but for all of us who are experiencing this pandemic in all of the places that we find ourselves going from day to day, for those who are outside and inside, whether you're with those that you're familiar with and those that you are not. We do continue to maintain those safety practices, washing our hands, sanitizing, wearing masks, social distancing. And yet at the same time, for us, that's tied to the recommendation of the virtual launch relative to the inability to give a 100% reassurance.
Okay. So same question to Dr. Beasley.
Well, I'll just say ditto to what Lisa has shared. We are starting virtually. Our goal, of course, is to at some point reassess and to move, as if we can, to a face-to-face situation. Of course, social distancing. The community may know that we were initially leaning toward a blended model, face-to-face and virtual, which would provide us an opportunity to social distance, reduce the number of kids inside a classroom on a given day. And that's one of the options that we may pivot to if the data supports that. Ultimately, we'd like kids to return face-to-face, but Marlon, I'd just like to share there's a school of thought out there that says if you've got to wear masks, if you've got to social distance, if you've got to be mindful of all these safety issues, is it really safe to return to a face-to-face situation? And we want, of course, to move in that direction, but we want everyone to be safe. We want students safe, we want staff safe, we want parents safe, we want everyone to be safe. And we've got to balance all of that. So our decision has been predicated in doing what's good for everyone. It doesn't necessarily please everyone, and we recognize that there are still challenges out there, childcare, etc. However, we're responding, as I heard Mr. WILBANKS share, we're responding to a situation the best that we can, given that students and school systems didn't create this pandemic. We're just responding to it. And I'll say this, we need the public to be responsible and to help us flatten that curve so we can get back face to face. We can't focus so much on our rights right now versus and abandon our responsibilities. Our children need us. We know what our rights are. Our children need us to be responsible.
That's
so
right.
We can get them back to school. And so I need everyone to understand that let's stop making this political. Let's get this curve flattened so we can get our kids back in school.
Mm-hmm.
Okay, Pastor.
Yes.
Let me ask Mr. Ragsdale the same question. Cobb County.
Yeah, exactly. Appreciate it. I was going to give Morcisa an amen there, but you beat me to it. So, that's the thing, right? The challenge is, and many have already hit on it, there is nothing that we can do to hit 100%, whether it be providing an environment that is 100% safe against the spread. We can do everything that we possibly can to reduce it, but there's nothing that we can do to guarantee it. The numbers currently on our registration portal are pretty much approaching half and half for face-to-face and virtual. Now, granted, the vast majority of our parents and students have not registered thus far, but there's still another week that the portal is going to be open for that. So that being said, we got to make sure that if we are able to have the two options, be it face-to-face and be it virtual, the primary priority for face-to-face is the health and safety of the staff and students. It's real easy to make sure that employees that are not working within a school building or within a classroom especially can social distance, can still do their job and be outside of those certain situations. But when you talk about bringing students back into the classroom with a teacher, there are things that are going to play into that that are going to be very complex, if you will, for us to handle, because again, we're being asked to do things that we've never had to do in a classroom. For example, contact tracing. When we do find out that there's been a positive case for a student or a staff member, then we are the ones that have to go back and identify either the employees or the students that have come into contact. The formula. Less than 6 feet for longer than 15 minutes. and then we provide that information to the Department of Public Health. And then they issue, okay, who is deemed to be at high risk and therefore has to be out for the next 14 days. If that's a teacher, that's obviously putting us into a situation to where a class of students now has no teacher. So those students have to be inserted into the virtual model. And that's why the virtual model is so important, for obvious reasons, for those that choose to go 100% virtual, but even for those that are just face-to-face. When we are having to add these additional steps, if you will, just to identify those individuals that maybe have come into contact, you can see that's why we are so focused on exactly how is the environment going to be maintained, both for safety as well as for teaching and learning, because that's our primary goal in a school district, is academic success. So if we're looking to teach and learn that in the same manner that we have accomplished before March the 13th, then we're going to have to take additional steps to ensure that that happens, whether it be face-to-face or whether it be virtually. And again, you know, I've got a board meeting tomorrow, so I'm trying to walk a fine line of not saying too much that I'm going to also be saying in the board meeting tomorrow. But the data right now that we're being provided multiple times a day through conversations with our local health department is just very, very concerning. When we're seeing the cases spike as we are, you know, we've already heard there's not a whole lot, as we heard from Dr. Herring, there's not a whole lot we can do to 100% guarantee the safe environment when the external environment is doing what it's doing. So back to Dr. Beasley's comment, we got to make sure that everybody is taking personal responsibility, that you know, you shouldn't have to be told what the right thing to do is to maintain your safety, your family's safety, whether it be in a pandemic situation or any other situation. You know, when we look at other situations before the pandemic existed, nobody had to be told to wear a seatbelt in a car. It was something that you had to do. Now, granted, it's the law and it's mandated, but we all know that there are people that still don't do that. Well, that being said, we have to make sure that we take personal responsibility, because every situation is different. A classroom environment is much different when you've got a teacher in a room enclosed with 20, 25 students. That's a much different environment than if you're able to be in a situation where you can socially distance properly. So we've got a situation now in school, in education, as many have already stated, we've never had to deal with before. And we're doing the best that we can. And it does look differently in different districts because, as Dr. Looney mentioned earlier, he's got Fulton County that goes so far north and south. There are different hotspots within the county. In Cobb, we're seeing a very high spread right now. We've got about 4 weeks left before the start date of school. So we're hoping things turn around, but we're also being realistic about that. And I think that's incumbent upon us to make sure we're prepared if we're faced with the situation that we cannot go face to face due to keeping our staff safe and keeping the students safe when they're there. Then we have to make sure we're prepared to go 100% virtual. At this point in time, we're still, like I indicated earlier, we're still keeping both options for face-to-face and virtual. But again, you know, our primary concern has to be the health and safety of the students and staff.
Absolutely. Our next question comes from Ava J. And the question is, how will teachers be protected? I'm going to start this one with Dr. Rivera out of Marietta City Schools.
Yeah, thank you, Marlon. And I think that, you know, I want to maybe echo a bit of what my colleagues have said. We all agree that schools should be open. The question is, can we do it safely? And as you talk about mitigating risk for staff, I think obviously for any of us who feel we're in a position where we can open schools, and I think, again, much like Chris in Cobb County, we're making this decision. We're continuing to evaluate this decision on a day-by-day basis. But in Marietta, we chose to require masks, both for the safety of students as well as safety of staff. I'll also say, though, as we look at these rates, I am concerned, and we will continue to monitor all the information that's coming to us from the Department of Public Health so we can decide if we can keep our staff safe. Let's be honest, every one of us understand that there's a different degree of risk for children than there may be for adults, and I think we have to take care of those teachers and those adults in our building who are not only beloved by our children, but by our entire community.
Absolutely. We're going to take this to Ms. Watson Harris from DeKalb County School District. How do we keep teachers safe?
Thank you for that. And I'd just like to go back to Dr. Beasley's point and also say amen to him. And just to reiterate how this is a time where we have to have bold and courageous leadership, even when it's not popular. And that's to ensure the safety of not only our students, but also our staff. And that is really why we made the decision in DeKalb County School District to delay the start of school and to start remotely. But something that I think hasn't been entered in the conversation as strongly is really not just the physical safety of our teachers and our students, but also the social and emotional health of our teachers. And in our survey and our community engagement efforts, we heard loud and clear from our staff that emotionally they were not ready to return to the school building. Many of our teachers are also parents, and although there may be a slight difference in how the virus is contracted between young people and adults, our staff don't want to bring anything home to our students. So we are taking that very seriously here in DeKalb and has used that data and that mindset in determining that we would begin virtually. But again, with a predetermined assessment points so that as the data changes, and hopefully we'll be flattening the curve, that we will be able to assess in real time. I think logistically, some of the things that we're also focusing here in our administrative buildings is modeling this new way of behavior, requiring masks, practice social distancing, disinfecting furniture and pens and things like that we've never really thought of before, and really modeling that in our administrative spaces. And then lastly, on a kind of more logistical side, also thinking about signage, things that we maybe have not considered before, and how we're branding safe practices. So we're working a lot with our communications team to develop signage that will go into all of our administrative and school buildings to remind students and staff about safe practices, as well as working with our translation and interpretation unit to ensure that we're thinking about access points for all of our community members, our staff, but also our families who English may not be their first language, and ensuring that they're being kept abreast of our policies and our practices. So we're working very closely with our staff and our teachers. We're listening to them. We're creating many opportunities for feedback to ensure that we're making plans that protect their physical safety as well as their emotional safety. Thank you.
Thank you for that. That's a good point that you made about translation. I know DeKalb has more than 180 different languages among its nearly 100,000 students. So glad to hear that that's happening. I want to throw back to Dr. Looney. Same question, Dr. Looney, for Fulton County Schools. What are you all doing? What strategies are you implementing to keep teachers safe and protected?
Well, first, thank you for the question. First and foremost, I think that the educational environment is the new front line for COVID because of what's about to happen with school resuming. I'm reminded of the healthcare workers that have been on the front line for so many months now, battling, treating patients and putting themselves at risk. And in many ways, we are now the next level or the next front line in making sure that we continue to provide services to the students that we pledged to serve in the safest way possible. And there's no way to guarantee everybody's safety. One thing to note is, once again, through our decision to offer face-to-face and a virtual option, teachers are in a position to make choices as well. So some of our teachers are going to choose to be virtual teachers. Other teachers are going to choose to do face-to-face instruction based on where they are individually positioned and what their risk level or tolerance for risk is. And so I think that in many ways that we're providing, teachers with the ability to navigate this COVID crisis on a very personal level. But at the end of the day, and this is our harsh reality, there's only so many things that any employer can do. And we're no different than any other large organization. Delta Airlines had to continue to operate, and their frontline workers continue to fly planes and provide services. So to have police officers and fire workers, and this is very difficult and very personal for us all. The unfortunate part of it is we're now faced head on with the crisis because we don't have a vaccine, and because our country and our state and our local community hasn't done enough to put the virus to bed for good. So until we as a society and locally and more globally deal with this crisis head on, then our school districts across the country, certainly here locally, are going to continue to try to navigate this complex environment with uncertainty, with anxiety, with imperfectness. We're going to do everything that we possibly can do in Fulton County to make sure that our teachers and students are as safe as possible. But there is risk. If we walk out of our house today and go anywhere, to the gas station, to the grocery store, then there's going to be risk associated with it. And it's unfortunate. And I feel for everybody. I feel for our teachers, our bus drivers, our lunchroom workers, but I also feel for my neighbors and the people that I would typically go to church with, because we just haven't done well enough as a society.
Thank you for that. I'm going to jump ahead to the next question, since we've got a dozen or three left on this page that I've got in front of me. And I'm going to start with Dr. Beasley out of Clayton County Public Schools, because this is something that I saw him speak on recently. Childcare has become a major concern for a lot of people as they're considering how students are going to go back to school. I wonder what the districts have considered in their part of that whole process on providing childcare. What things are going to be implemented, and what outreach, if any, has been to local business leaders. I think we've heard a little bit of something over the last few weeks about business leaders being included in some of the discussions, but what is the child care conversation like inside the school district, Dr. Beasley?
Well, Marlon, the child care is a national issue. Everyone is realizing that schools are the de facto child care institutions. That's why it's important. It was important on the front end of this to get this under control, because we knew that eventually we'd have this conversation about what to do about school. So I'll just say this, you call me pastor, whatever. When you choose not to make the tough decisions on the front end, it always makes it harder on the rear end, and so harder and longer, and that's what we're dealing with. But as a community, we don't have the solution for childcare if we don't bring all students back face to face. We're asking the entire community to step up to the plate. Faith-based organizations, families, auntie, Nana, and all of them, we need everybody to step up to the plate to help us ensure that our children have the supervision if we're not coming back face to face. Remember, the schools, we're dealing with this as everyone else is dealing with this. We're trying to, and honestly, we're feeling the burden of trying to come up with all the solutions. Maybe we ought to be running the country at this time. But we're not the ones that have all the solutions. We're just trying to figure out what to do to move our communities forward. And so we're asking everyone, our partners, our families, our community members, faith-based organizations, everyone, until we can bring children back to school face to face, childcare will continue to be an issue, not just for Clayton County, but for all the districts in which students are all not back in school face to face. So we need everyone to step up to the plate, and we need our elected officials to identify resources to help families if there are additional child care expenses or school systems. We need the federal government. We need possibly more stimulus funds for early learning support. We know our families that have the small babies, the kindergarten, first, second, third through fifth grade, they really need that support. And so again, until we can bring all of the students back face to face, we've got to come up with creative solutions and ideas for addressing child care. We need our parents. Our parents need to get back to work, but they need children in school face to face. So again, I'll say that's why it is important for us to do what is hard and get this pandemic under control so that our children can get back to school and so parents can get back to work.
I'm going to figure out a way to get a virtual collection plate out here before we get done.
I got a Cash App if you need it.
All right, we're going to go to the Amen Corner. Dr. Herring out of Atlanta Public Schools. Tell me a little bit about what's being done from the Atlanta Public Schools perspective, because I know childcare is a big concern over on your side of the region.
So, thanks again, Marlon, for the question. I have to echo my friend and my colleague, Dr. Morcease Beasley, in having spoken the truth. And it is a difficult but true statement that does have to be made. Certainly, our goal as educational leaders is never to create a scenario that inconveniences the families that we serve. We didn't create the pandemic, and all of us are impacted by it. In Atlanta Public Schools, we continue to explore what those options will look like. In a perfect scenario, I could immediately outline for you 10 to 12 that covers every scenario for every age group. We don't have that yet. We do have partners like the Boys and Girls Club and the Y, and we have partners like churches, but even they have to have precautions that they need to take heed to in order to ensure that we remain safe. And that even if they are providing resources for us in that regard, they have to give reassurances. When I heard Dr. Beasley make this last statement, and I was over here doing my own head nod, he brought to my attention the importance and the responsibility that we do have as superintendents to continue to remind everyone, for as much as the responsibility falls on us to come up with the best decisions that we can, we have to echo, because we have a platform, the importance of following the guidelines right now that will bring these numbers down. And so I'm just simply going to, even in this forum, tag team with him and echo that. We continue to identify ways to provide childcare. We don't have all of the answers, but we are leaning on partners. We put a lot of thought into what that would look like, even in a hybrid model. And even in the hybrid model, our first tier, as it related to those students onboarding and coming back into the system, would be our youngest learners, our students with disabilities, our ESOL learners, our students who are transitioning from elementary to middle or from middle to high. But I think part of what's missing in this question is providing childcare, making childcare provisions, but also being able to give a level of reassurance of safety. And that's the space we can't fill. The only thing that we can do in that, here again, and I'm by design being intentionally redundant, agreeing with the message that we want to do as much as we can, even with the partners who will help us in a childcare model, but we can find ourselves in a space where perhaps we're not even entertaining that if we all simply do what we must do to help bring these numbers down.
Thank you for that. Mr. WILBANKS, you manned one of the largest school districts in the country, so I'm sure you've heard from a lot of people about things such as childcare, which seems to be on the mind of people everywhere. What are you hearing, and what are you and the other leaders in Gwinnett County schools doing to address any concerns with childcare? Oh, let me get you to unmute.
First of all, Marlon, let me congratulate my colleagues for doing a great job in responding to these questions. I think the realistic thing is we may be expecting more schools than schools can deliver. And I know everybody on this call is going to do the very best we can do. And we should. That's part of our responsibility to offer a quality and effective education to every child. But some things we just aren't able to do. We can certainly be partners. We can certainly do our part with what we can do. But if we look at what the challenges before us are, I think all of us want to do. We want to offer in-school instructions if we can do it safely. If not, then we'll have to provide a choice. Some feel like that we need to start off with digital learning, and I think that's a good decision for them. And I think what we've got to do in doing that is realize with each plan that we have, there are a lot of issues that the public, as cooperative and as great as our parents are throughout the Atlanta area, we have great parents in Gwinnett, great community members, but I think they're looking to the schools to do maybe what we aren't prepared to do. Now, should we do some things differently and be prepared to do that and during this time? Absolutely. And I think you've heard a lot of suggestions today about what these districts are doing. And I just want to commend my colleagues for the great work I think they're all doing to try to make sure that they are ready for school and provide whatever way it is, in school or distance learning or remote learning, to our students that we need to serve.
Thank you for that. So I'm noticing that we're getting close to 6 o'clock, and I still have about 24 questions in front of me. Let's see if we can answer a few of these sort of rapid fire. I'm going to start this one with Dr. Rivera from Marietta City Schools. What are the staffing plans for when teachers test positive for COVID-19?
We're working in collaboration with our local Cobb Douglas Public Health, and there's a very specific protocol that they have identified that if a teacher were to test positive, then that teacher, as it's been presented to us at this time, would be required to go out for a minimum of 14 days. So we will work with them to determine whether it's one negative test or two negative tests following that. But at the end of the day, as these protocols continue to evolve, whether it's staff or students, we're going to follow those to the letter as directed to us by the health experts.
Okay. Mrs. Watson-Harris, same question. What is the protocol for when a teacher tests positive for COVID-19?
Very similar to what my colleague just shared. We're following the guidance from the Department of Health. We also here in DeKalb County School District have a COVID task force that I've seen in action when we've had these incidents, and following it from a notification until the building is clean and staff are able to return to school. But also, again, bringing my experience from New York City when we had very similar cases and just kind of assessing the protocol here and offering any additional feedback where we can tighten up. But we will be following the guidance from the Department of Health. Thank you.
Thank you. So let me ask this for anybody. Raise your hand if this is the case. And I've seen this question a lot, so I'll just ask it. Is there any district that has decided that if someone were to test positive for the coronavirus, they would be allowed back in the building the next day? It's an interesting question, but I said I saw it so many times, I figured I would ask. I don't see any hands raised, so thank you for that. We're going to go to the next question. What are the protocols if one of the children or a close contact tests positive? And we're going to start this one with Dr. Beasley out of Clayton County.
Well, Marlon, of course, we're starting virtually, but in the event as we move along in the year and we can bring students back using a blended or face-to-face model, of course, we'll just follow the guidance of the health department. I've heard, as a matter of fact, on the other day that they're not suggesting that we shut the school down or shut the entire classroom down. So it's a matter of identifying who was impacted, who had contact with the child, and making the appropriate decision at that time. But as I stated earlier, the goal is safety. And so if we find ourselves as a state, as a metro area, as a state, as a nation in a situation wherein people are not safe, then we must question whether or not it's Are we bringing students and employees back into the facility, our schools, at the right time? Is it a safe time to do so? But we'll follow the guidelines and the health experts' advice as appropriate.
Thank you for that. Dr. Looney, Fulton County Schools.
Well, thank you for the question. The way that we're approaching it, obviously we're following the CDC and the Department of Public Health guidance, but I need to say that contact tracing is not where it needs to be, nor is testing. So we have people that present positive, and we're going to assume perhaps that they're positive prior to them getting a test result back, and just because there's such a delay and it's a cumbersome, clunky process. With that being said, student or staff, we're treating them all the same. If a student and or a staff member tests positive, they will be excluded from our school environment until they've been cleared to return from a public health official. The remaining students and or staff that have been in contact with that individual will be sectioned into two different groups. People that have had direct close contact as described by the Department of Public Health, within 6 feet for 15 minutes or longer. Those people will be asked to self-quarantine for a period of time until the Department of Public Health has had the opportunity to contact tracing and determine whether or not they are it's safe for those people to return. People that have had incidental contact or very little contact will be allowed to return to the school or work environment so long as they continue to self-monitor for symptoms or signs of COVID-19.
Thank you. Those last two questions, the one about staffing plans came from Charlotte C. And the second question about protocols if a student or a relative or someone in contact with them tests positive, that came from Jimmy H. Thank you again to our public for the questions that they have been submitting. The next question is going to be from Emma W. And it's going to be for Gwinnett County School Superintendent Alvin WILBANKS. Mr. WILBANKS, after reviewing the CDC guidelines for reopening our schools, Gwinnett County Public Schools is not following those guidelines. Instead, teachers will be placed at great risk by attending school in person with students who are not required to wear masks. Why? Uh-oh.
I'm sorry. Marlon, the first part of that question, we are planning to have students wear masks. As a matter of fact, I think at our last board meeting, last month, we decided that that would be the case. We also don't feel like we're violating anybody's CDC particular guidelines. We plan to have our schools safe. They will be clean. They will receive frequent cleaning. We intend to have not just students, but everybody wear masks or face covering, whichever is appropriate. And we certainly think that if we're going to offer instructions, we have to offer the best instructions we can. And we think they can do a better job where they're at the school, where they can work together, plan together, and be collaborative and making sure that lessons coincide, whether it's in-school instructions or digital instruction. So that's why we are asking our people to return. Obviously, if someone has underlying issues, health, they have a doctor's excuse, we certainly plan on honoring those.
Thank you. Our next question is for DeKalb County School District Superintendent Cheryl Watson Harris. It comes from Olabisi T. I would like to know what DeKalb's plans are for school reopening. Also, if school reopens with some students attending school and some taking online classes, would that classroom teacher be expected to teach face-to-face as well as the online ones?
Okay, thank you so much for the question. We have decided to delay the start of school to the 17th, and we are going to return virtually with predetermined assessment points. So every month we will review the data points and decide what is in the best interests of our scholars and our teachers. We're also, as I said a little earlier in the call, reassessing or assessing our successes and challenges from the spring. So we're in the process of developing a robust teacher professional learning series that will exist or happen the week before the start of school, as well as have 1 day per week during the first month to recalibrate and provide additional resources, supports and services to our teachers as they navigate this new space, as well as paying close attention to the digital divide, and ensuring that we're monitoring student engagement, as well as making sure that the devices are in hand. So when we decide that it's safe for students and staff to return to school, we will then be able to answer the second part of your question in terms of expectations for teachers. But we have decided to begin virtually. Thank you.
Thank you. Our next question is, will social distancing become a permanent part of the school curriculum? I'm going to start this one with Dr. Lisa Herring out of Atlanta Public Schools.
It doesn't want to come off mute, but there we are. Thanks so much again for the question. Will social distancing become a part of the curriculum, or perhaps even the question is, will social distancing become a part of the practice? You know, I think that what we are all learning at this season is that we will pay more attention to how we physically interact than we ever have before. Not just now, once the pandemic has calmed itself and we've moved out of what is a global pandemic, I hope that we will be more thoughtful around how we engage, how we pay attention to the way we do practices that have always been taught as early as kindergarten, whether that's hand washing, covering our mouths when we sneeze, you know, those hygiene practices that help ensure safety. But as a part of the curriculum, or really as a part of the practice, I think that's an answer that goes beyond just school. It's how we engage in our society as human beings. I don't know how many of us can say we have or haven't done the elbow greeting. In the last several weeks, as I've transitioned back home into Atlanta, I've been greeted by an elbow, a unique back hug, and even a kid and play kick with the heel of my foot. And I have not been offended by any of that. I think that we will, as a educational system, be thoughtful about those practices. Will it merge into the curriculum? What I hope merges into the curriculum is the importance around health and well-being. I hope that we will continue to focus on social emotional learning as an area of focus in our curriculum. We are in Atlanta Public Schools. I also hope and believe, and I guess I shouldn't say hope, but we'll look to deliver beyond just that, the opportunity to understand the power of science and data, and how, for us, the decisions that we make need to be grounded in just that. And what is authentic in that research and what may or may not be. Because our ultimate goal as educators and as a school system, when our core business is teaching and learning, is to not only ensure that our students are successful, but our teachers are well equipped to educate them. So the curriculum does matter. Where does social distancing fall in that? I think it'll be in our day-to-day practices. I hope that in our curriculum, we'll focus on also the things that will allow us to be deeper thinkers, more thoughtful around how we embrace humanity, and how, when and if a pandemic occurs again, we will have developed the next round of researchers, scientists, and doctors who will come to a solution sooner than later.
Thank you for that. All right, Mr. Ragsdale, same question to you. So in Cobb County schools, do you see social distancing becoming a more permanent part of the curriculum?
Yeah, I'm going to immediately echo Dr. Herring's remarks about the curriculum. I don't see it becoming part of the curriculum, but again, is it going to be part of the practice? You know, I've encountered a lot of people since this started back in March. Some just still extend the hand, like, you know, you're going to shake hands just like we've always been taught. That's professional greeting. And then, you know, the other person wants to do the fist bump, the elbow bump, and then you have that awkwardness, you know, of, okay, you pull your hand back, or, you know, that kind of thing. So, yeah, it's going to take a lot of getting used to. I mean, let's just face it, you know, shaking hands has been the professional greeting longer than any of us have been around. So changing that is going to take some deliberate attention. Changing, and unfortunately, we're saying changing on a lot of the hygiene habits, right? Because this should have already been in place as far as washing your hands frequently, doing it for the 20 seconds to make sure that you've done it long enough to kill the germs, to get rid of the germs when you're doing the hand washing, covering your mouth when you sneeze. Here's something that has always been just a focal point of mine: staying home when you're sick. And we've identified a lot of those things that actually encourage students to come to school when they're sick, such as, you know, the attendance related items that you have, whether it's to be exempt from a test or whether it's the perfect attendance, those kind of things. So some of the things are going to remain permanent, because you just can't have a practice in place that encourages people to do things that are going to put others at risk. And again, like Dr. Herring said, this pandemic is going to get calmed down at some point in time, hopefully sooner rather than later. But we still have flu, we still have colds, we still have all of the sicknesses that plague. And, you know, last year and the year before, we had schools, not in Cobb, but we had schools across the country that were having to close because they had 40 and 50% of their students out to the stomach flu. Mm-hmm. So these kind of things, and a lot of those practices that are now going to become very normal practices, not just with students and staff, but with cleaning. And different technologies that can be utilized for disinfecting and ensuring that we are keeping as clean of an environment as possible for our teachers, our staff, and our employees and visitors in the building, quite honestly. So I think that some things will probably be permanently changed, and for the better, and they should have already been in place. That's the unfortunate part, is a lot of the flattening of the curve that we have all become so familiar with could have already been done had we have already been doing the right practices all along. So if there's you know, a silver lining to this pandemic, and I hate to even call it that, but if there's some good that can come out of it, perhaps it is a more laser focus and a more awareness of being sensitive to others when you're in fact sick. I know that we all think that we have the most important job in the world and we have to, you know, push through when we're sick and don't feel good. But in reality, you know, you're causing that domino effect with others to become sick. So I think that that's probably one thing that should be here to stay, and should have already been here to stay. But talk about social distancing. You know, some of it will remain in place, I'm sure, but the 6 feet kind of thing, I don't see that being a permanent solution, because in a lot of situations, it's just impossible to obtain. For example, students on a school bus. You know, we have over 75,000 students ride school buses to and from school and home every day. So being able to social distance on a school bus is impossible without infinitely more drivers and infinitely more buses, or else, you know, it's already bad enough when you have elementary school students having to catch the bus at dark 30. So we don't want to see that go the wrong way. So that being said, you know, all of this has been exacerbated by a budget cut that we have all experienced. 10% for us in Cobb means $62 million. That's nothing to blink an eye at. So while we're having to do a lot of things differently, and some come at a cost, some at a substantial cost, we're also having to balance a substantial budget cut. So, and I know we're all striving to attain that budget that does not negatively impact employees. That being said, you know, a lot of us did things at the last part of the academic year last year to make sure we were able to pay employees. And we're in a different situation than business and industry in that the way that we're funded, we were able to do that. And I think that was a huge benefit for not just the employees, but actually our local economies. Because as we're trying to get everything restarted, I think that, you know, we have to be very, very careful to balance that restart with health and safety. You can't have the pendulum swing too far either way, or you're going to get out of balance and have negative impacts and consequences. So to your original question about the social distancing, some things are going to stay in place and should have already been in place. And some things, when the pandemic settles down and we get back to either having a vaccine or having a solution, whatever that is, for the COVID-19, we will be back to being able to be a little bit closer than 6 feet with people we don't know.
Thank you for that. I feel like I need to take a sip of water for you. So I'm going to first thank you, Morgan P., for that question that was just thrown out. But if you all are just joining us, we're having an AJC Community Conversation with Metro Atlanta's superintendents discussing the return to school at the coronavirus as it rages on. Our next question, and we're gonna start looking to wind down. I've got 2 more questions in front of me. Next question comes from Andrea J. How will you handle mask wearing for pre-K and kindergarten students? I'm going to send this one to Dr. Morcease Beasley out of Clayton County.
Well, thanks, Marlon. I'd like to, if I may, your last question about the social distancing becoming a part of the curriculum. I'll just say, I'll respond. I support what my colleagues have shared, but I'll say this. I just hope that we get to a point where we just believe in the science and we allow the science to inform our practices. Science is science, and we need to trust our scientists, trust the process, train our students to be scientists, and allow the science to inform what we do and how we do things. That science has made us better as humans. We live longer because of science. We have a lot of benefits that we're all living out and experiencing because of science. So I would say, let's trust the science and let's use the science to inform our practices, whatever those practices may be or need to continue to be. Now, to your question, when it comes to masks, we're encouraging our parents, if we return face-to-face at this point, if once that decision is made, we're encouraging our parents to send students to school with masks, but we're going to have a good supply of masks at all of our schools, and face shields. I should say face shields, because it's not appropriate for some of the smaller babies to wear masks. So we'll have face shields. But again, I have to say this. If we have to require a mask, then we should ask ourselves the question, is it the right time for us to bring our children back to the schools? And so we need a vaccine. We need to flatten the curve. We need to do whatever it takes to create a safe situation so we can create a normal social educational experience for our students in our schools. So yes, we're encouraging masks. We'll have a good supply for those families and students, for whatever reason, can get a mask. However, I want us to think about the science, not just of wearing a mask, but think about the science of educating our children, the social interaction. I'll just tell you, I have great concerns about children in classes with screens between them and their peers. I just have great apprehension about that. And so I want us as educators and as a community, as citizens of this great country, to think about what we're asking, or what we would be asking about children, about educators, if we require all these things. Again, Let's look at what the science tells us. Let's inform our practices, but let's really think about what we're asking and what we'd like our schools to be and look like, not only during this pandemic, but after the pandemic.
So we're going to take the same question to Dr. Rivera out of Marietta City Schools.
Yeah, thank you, Marlon. And I'll follow up on what Marcy said. So we have an early learning center here at Marietta City Schools and 120 plus kids. And I will tell you that we're able to open, we do expect the kids to wear masks, and we're going to take additional precautions. We understand that if it's safe enough to open, and I continue to say if, that the extra precautions we may need to take in a building relative to social distancing with preschool students or having them outside or even partitions in different places throughout the classroom. This idea that with a 4-year-old, I am incredibly sensitive. I have a 4-year-old, and I'm incredibly sensitive to the idea that, yes, I want her to understand how to wear a mask. I also want her to be able to see her teacher's face. And you start talking about how can 4-year-olds start to acclimate to education when 2/3 of their teacher's face is covered. So we really navigate all this very delicately. We understand how important it is for students to have the social emotional learning and the phonemic awareness that comes at the age of 4. I think I also echo what Marcy says, which is we understand that at 4 years old, having a mask on for a large portion of the day may be a challenge. So we start to explore those other mitigation strategies that allow us to accomplish what we know is important for children and for childcare and for families, but also what will be at least the safest mitigation practices possible for our staff and for our youngest learners.
Absolutely. I think I saw a story in the Wall Street Journal where a class of 4 or 5-year-olds were sitting in hula hoops, and they had all of their stuff with them in that circle. So I think everybody's trying everything they can at this point to figure out the best way to make these things happen. So we're going to go to our last question. I'm going to ask it to all of you. There's a question that says, if a vaccine does come and it's proven effective, will everybody be required to take it? Students, teachers, etc. I'm going to start this question with Dr. Looney out of Fulton County Schools.
Well, thank you. I don't know. That's not my decision to make at this point in time. I will say there's 2 things that I want to say before I get off the call, though. One is what a travesty that we're here, and we as a country can do better. And it's just tragic to me that we're talking about having 4-year-olds wear masks in school, and how do we try to maintain some sense of normalcy. The second thing I want to say is this. I don't know of a single research study, and I've been doing this for a long time, so have my colleagues, that indicates that remote learning is going to give you the same kind of student outcomes that we all hope for and desire with students. So I think it's really important that we give truth in advertising to our families. We're all going to do the very, very best we can with virtual and remote learning, but make no mistake about it. There is no substitute for a highly skilled teacher in a classroom with boys and girls, interacting with them, building relationship with them, and exposing them to new content. And we all desperately need to get back to that. There is no going back to where we were before. We're all going to be changed, hopefully in positive ways. But we need to get back to face-to-face instruction as soon as humanly possible, because that's what works best for boys and girls.
Thank you for that. Dr. Herring out of Atlanta Public Schools. Uh-oh.
Thank you, whoever had that.
Sorry
Thank
about
you.
that.
So thank you for the question. Let me just say in brevity, if a vaccine becomes available, the decision for any human being, but particularly children, to take that vaccine really does rest in the decision of parents. Anything that becomes a mandate beyond that is something we would have to pay attention to. But as a parent, although I have an adult child, I take very seriously those levels of responsibilities and that level of decision making. So that's how I would want to answer that in the space of safety and wellness. That's not to ignore what a best practice might be. We all immunize, the vast majority of us, at the start of the school year for reasons for which we've grown to understand. And so if that is something that becomes a reality, perhaps it then becomes a part of that level of expectation of what's required before entering school. So, and then still that level of responsibility rests with parents. As a last question, I would also just like to take the opportunity to thank AJC for this platform, but to also acknowledge how powerful it is to bring together the superintendents from the greater Atlanta area to utilize voice. And I hope that as much as this is historic, it's not a last. So thank you.
Oh, it won't be a last if I have anything to say about it. Thank you for that. Mrs. Watson Harris out of DeKalb County Schools. I know you've got a student who will soon be beginning his first year with the DeKalb County School District. Tell me what your thoughts are on a vaccine and whether it should be mandated.
I join my colleagues and really appreciate the responses that have already been offered. That really must be a personal and in some cases religious choice about whether or not students will be receiving that vaccine, students and staff. But since I've answered the majority of my questions in a New York minute, I'd like to just take a little bit of additional time here also to thank you, Marlon, for putting together this really powerful opportunity, and also to my colleagues. I see I'm in great company and on my 11th day, really seeing just the wealth of information that will be available and support and really inspiration in such a diverse school of thought. So I look forward to being a part of this team and learning from each of you. Also, just one thing I wanted to mention is that the majority of the questions posed to us were general in nature, what we expect for teachers or for students or for parents. And I do just want to acknowledge, and I know my colleagues probably are as well, that when we think about teachers and what's best for them or students, it isn't just a homogeneous group. And so I know our team here in DeKalb are thinking very critically about staff members that might have underlying health conditions or fall into a vulnerable population, and how our policies are differentiated to make sure that we're thinking about the reality of each kind of protected group, if you will. And for our students, what we're thinking about in terms of our students with disabilities and the quality of care and educational experience that they're providing to different students with different needs. So I just wanted to offer that because I know that some of our stakeholders that are listening may be wondering about our intentionality to differentiating our supports and services for all of our stakeholders. And just lastly, and you touched on this, Marlon, I am coming here with my youngest son who will be entering the 9th grade. So I am not only the superintendent, but I'm going to be a proud DeKalb County School District mom. And what's top of mind for me, apart from the safety and of our students and staff, is also how do we begin to think about this new reality and how we will maintain a joy for learning and get students and staff excited about this school year in a new way. So as much as this is as my colleague said, this is a tragedy that we're dealing with this, it's clear to me that we have the right people on the bus to move ahead of this and think, creatively to ensure that students are excited and that we create new traditions and rituals so that they enjoy their school year. And I'm just excited to be a part of that. So thank you so much.
Thank you. Mr. WILBANKS out of Gwinnett County Public Schools.
Marlon, I hope they do come up with a vaccine. That would be great. I don't think it's the responsibility of the school district, however, to decide who does that. It probably, if there is a vaccine developed that the health community field is needed, it would be put in the requirements of other immunizations for kids coming to school. But it's not for the school system to say who does or who doesn't.
Thank you for that. Dr. Beasley out of Clayton County Schools.
Well, I'll just say thank you, Marlon, for this opportunity. Always great to interact and share with my colleagues in the metro area. And I will just say, we're going to do what's best. We're going to do what's right. We're going to be mindful of others. We're going to put ourselves in the shoes of others and make decisions that in the best interest of others, as we would want others to make in our best interest. And I think we need to be flexible. We need to be empathetic. We need to be considerate. We need to be compassionate. And we need to show leadership. We need to be truthful with individuals. We need to be grounded in accurate and verifiable data. We need to, as leaders, we have got to do what is right, not for our individual selves, but for our communities, for our children, for our employees, for the stakeholders at large. And we've got to balance this. But leadership is critical through this very complex situation. And so thank you for this opportunity. I think the AJC did well to have this forum. My colleagues, I think they have done well to respond. We ask for everyone's patience and understanding as we navigate this most difficult circumstance that we did not create, but we all have been called to respond to. And so I just challenge all of us to respond to it in a manner that provides dignity and uplifts all of our various communities in our state and nation at large.
Dr. Rivera from Marietta City Schools. I know it's been a second. Let me know if I need to go back.
Gotcha. No, I mean, I'll answer your specific question and then maybe speak more broadly. So as far as the vaccine, I do believe that's a personal decision. I think there's an opportunity, while we may ask the question about the vaccine, how have we really taken this moment to educate families about their health and well-being? And how do we as schools be partners in that conversation, maybe in ways that we never have before? So I think there's an opportunity there. And I guess I'll close with this. I'm a former special education teacher, turned high school principal, now turned superintendent. And in all those roles, I have incredible hope about how education can impact a child and move a community. And as tragic as this has been, there have been such glimmering signs of hope. You look at how educators across the Metro Atlanta region have stepped up to support our children. You look at how business community has partnered with our schools. One of the things that gives me the greatest amount of hope is we are partnering with families in ways that we have never done before in the history of education. And I join very humbly my colleagues, and we collaborate and we make decisions that are best for our community. We bring all the compassion and heart and experience we possibly can. And what I hope is that together, with grace and understanding and flexibility and with science, as Maurice said, there will continue to be hope for what we have been and what we will be. And I hope that's not lost in this moment, because certainly it's what continues to inspire me as an educator and the opportunities that we have. I remain incredibly hopeful, especially with this group of leaders in our schools today.
Thank you for that. Now, last but not least, Mr. Chris Ragsdale out of Cobb County Schools.
Thank you, Marlon. So to answer your question, I agree with everyone that has already said. It's not in our purview or authority to require a vaccination for students attending school. Certainly that's within DPH, and that list grows. As a matter of fact, the meningitis now is added to that required list of vaccinations. So assuming that we get a vaccination that actually works and works well on all strands, if this thing mutates and those kind of things, I can see that, yes, that would be certainly added to that list. That being said, I echo all of my colleagues here. One common denominator that we're all saying is that we're doing and going to continue to do the best that we can. Again, I mentioned, potential silver lining or some of the good that has come out of this. Another piece of good I think that is coming out of this is a greater appreciation for our teachers. We have seen, unfortunately, when we had to go all virtual, parents truly saw exactly how difficult teaching is. And what teachers do each and every day, day in and day out, the sacrifices that they make of their time, And we saw that also come to fruition in the teachers that were doing drive-by visits for their students. We had multiple teachers highlighted on local news media about what they were doing. The way that our educators came together to recognize our seniors and all that they had lost. It's really heartwarming to see that everybody else is getting to see how much teachers care about those students, not just to see their academic success, but actually cares about their well-being, that they care about what happens with the student when they leave the classroom and go home and then come back the next day. We have seen how important it is that students get to have healthy meals at school when maybe they would not if they're not in school. So we had totally pivot to make sure that we were continuing to provide those healthy meals for students that were in the greatest need. So there's a lot of good, to echo what everybody has already said. There's a lot of good that has been identified and highlighted and will continue to be. And that's why it's so incumbent upon us to make sure, as everyone has already said, when we come back to school, we got to make sure that we have to make sure that we are protecting both students and staff. When we are putting teachers in a classroom and we're bringing 15, 20, 25 students into that classroom, we got to make sure that everybody is going to be safe. We have heard from our teachers, and I know that, so many things are changing with decisions and data and that kind of thing, but we totally hear and understand and are going to protect those teachers that have those situations to where you have an elderly parent at home, you have an immunocompromised student at home. We are very cognizant of that, and we're putting that into the plan to make sure that everyone is as protected as we possibly can. That being said, I'll go back to Dr. Beasley's comments about if we're going to have to mandate A and B and C and D and a list of things, can we truly say we're going to be in the safest environment possible? Now, again, I go back to my earlier comments about we can't allow the pendulum to swing too far from one side to the other, but we have to make sure that we have the proper balance in place as we come back to face-to-face instruction, whenever that is going to be. So all of those kind of things said, Marlon, I really appreciate the AJC, this community conversation that we've had. I think it has provided a platform for all of us to come together. And it's not like we never do this, right? We've had the MRISA calls, we've had personal calls. What are you thinking? What, where are you leaning towards on this? And again, it's not that so we can do exactly the same thing, but it's so that we can share with each other. Okay, here's what I'm seeing with this. And that may not be true for Cobb County that it is in Atlanta Public. And that's just going to be the reality of the communities and the differences in everyone that's represented here. Yes, we're all Metro Atlanta, but just as Dr. Looney said, in his county, he's got hot spots because he's got such a geographically diverse county that's spread out. So we all have different challenges, but we all have some of the same challenges as well. And I think it's just very important for us to say everyone has to do everything that they can, whether we're in school, whether we're at home, whether we're at work, or whether we're at the grocery store. We all have to make sure that we get through this as positively as we can and as fast as we can so that we can get back to whatever the new normal is going to look like. So, Marlon, I really appreciate you guys putting this on and giving the opportunity for us to have basically a town hall of the largest districts in the Metro Atlanta area. It's been very beneficial for all of us, I think.
Absolutely. And look, you all could have been anywhere else this afternoon, but you chose to spend it with me and the AJC, and I can't thank you enough for that. I know our readers and the folks who have tuned in are definitely, probably don't have as many questions as they had when they started out. I hate that we couldn't get to every question that we had laid out, but I love the fact that we were able to do this. I also want to thank our viewers, because we ended up with more than 3,000 people taking part of this conversation this afternoon, and do a little something to pay the bills. Let me read a little something. We offered the event as a public service, and we owe a special acknowledgement to our subscribers. Because of your support, we were able to make the subscriber benefit open to everyone. Our reporting, local journalism, is because of our subscriber support. If you don't subscribe, please consider doing so. Go to ajc.com/subscribe to join today. Thank you, and continue to follow our reporting in the Atlanta Journal-Constitution and online at ajc.com. Again, many thanks to the superintendents. Richard was the school superintendent for the state of Georgia, ended up not making it after all, but he sent his regrets. And again, can't say enough how great it was to see all of you today. Thanks again, and you all take care.
Thank you.
So I think we're going to stay